Today we'll be talking about antihistamines. They're a class of drugs that are most commonly used to treat the symptoms of allergies. They work by competitively inhibiting the action of histamines on the H1 receptor. So by doing so, it decreases the calcium ions in the body, which is responsible for these symptoms that you may experience during an allergic reaction. There are two types of antihistamines that we will be exploring today. The first one is first generation. They're also known as sedating antihistamines, and the second group is the second generation, and they're considered less sedating. The reason why they're first and second generation is because the second generation are much more newer compared to the first. Let's take a closer look at first generation antihistamines. Not only do they work on stabilizing the H1 receptor in an inactive form, it also has some anticholinergic activities because it crosses the blood-brain barrier quite easily. Now this leads to the possible side effects of sedation, dry mouth, and psychomotor impairment. It may also cause the paradoxical effect. This is where the patient or individual may experience the complete opposite of sedation and instead may experience excitation. Its common indications are for allergic conditions, itch, as well as nausea and vomiting. It is also not recommended for those taking these medications to take any alcohol or other sedating medications, as well as avoid use in elderly and children below 2. When it comes to pregnancy and breastfeeding, there's some evidence to show that it is quite safe in both, but short-term use should only be used for breastfeeding due to its sedation. It's also advised not to drive or operate machinery when taking this medication. Now let's take a look at the individual types inside the first generation antihistamines. If we take a look on the screen, there's exactly 8 first generation antihistamines that are available in Australia. Now the first one's most commonly used or only available in hospitals, so there'll be less attention to that today. One thing that should be noted on silazine is that it's mainly commonly used for post-operative nausea or vomiting. Going down the list, you can see the brand names listed in brackets, as well as any special information regarding each one. Here you can see each product except silazine. They're arranged in an order where it allows me to categorize them based on their indication. On the right here we have diphenhydramine as well as doxylamine. They're most commonly used for short-term to moderate insomnia. They should only be used for less than 10 days because they lose their effect over continued use. Unisum is 1 capsule 30 minutes before bedtime, whilst the rest of it is 1 or 2 tablets 30 minutes before bedtime. Next we have promethazine. They're considered the all-rounders because they can be used for anti-itching or allergy-like symptoms, travel sickness or nausea and vomiting, as well as sedation. Next we have phenyramine. They're also considered all-rounders, but are most commonly used for travel sickness or antiemetics. Their dose is half to 1 tablet 3 times a day, and is usually taken 30 minutes before traveling to take effect. Next we have cyproheptadine, dexclorphenaramine, and trimeprazine. They're just over here, and they're generally used as anti-itch or allergy symptoms only, with the exception of cyproheptadine. Now the special thing about cyproheptadine is that because it has anti-serotonin properties, it's also used for serotonin toxicity. It's also indicated for migraines and vascular headaches. It is important to note that the use of cyproheptadine for migraines and vascular headaches lack in evidence. One of the common side effects for cyproheptadine is an increased appetite as well as weight gain. When it comes to dosage, cyproheptadine is 4 mg 3 times a day. When it comes to serotonin toxicity, its dosage can be varying depending on how severe the toxicity is. Dexclorphenaramine's dose is 2 mg 4 times a day, whilst trimeprazine's dose is 10 mg 3 to 4 times a day. The doses that I have given are very specific. For individual uses, they can vary depending on their indication as well as age or other factors. Now let's take a look at second generation antihistamines. Much like the first generation antihistamines, they stabilize the H1 receptor in an inactive form, but they don't have those anticholinergic effects. However, they may still cause some drowsiness, fatigue, headache, as well as dry mouth. They're generally used for allergic conditions like itch as well as chronic urticaria, and it may also cause sedation. In terms of pregnancy and breastfeeding, they're both safe, but there's more information and evidence in first generation antihistamines compared to second generation. There are 4 second generation antihistamines. They are cetirizine, fexofenadine, loratadine, and desloratadine. Here you can see a small packet of each medication. Because second generation antihistamines are less likely to cause sedation, they are Schedule II drugs, also known as pharmacy medicines, that are available over the counter. Their dosings are 1 tablet a day. Of the 4 medications, cetirizine is the most likely to cause sedation, and it's estimated about 10% in the whole population. Telfast or fexofenadine should not be taken within 4 hours of any grapefruit juice or grapefruit, as it may affect its efficacy. Same goes for its liquid form with any fatty meals. The most frequent question I get asked is which antihistamine should they take? The answer is it's hard to say because each person's body reacts differently to each antihistamine, so the best way to find out is to try each one and find which one works best for you. Thanks for watching Antihistamines.